In this topic of cervical fascia, as you understand, cervical means in the neck region, fascia means it is kind of a connective tissue making a sleeve around the muscles, around the viscera. As such, there is a superficial fascia and there is one deep cervical fascia. So we'll be focusing mostly upon the deeper layers. So in the deep cervical fascia, there are three names which we have to focus upon. And as we talk about them, let us take one transverse section in the cervical region so as to understand them better. Say we have taken a transverse section in the neck region, and this is anterior, that is the posterior, and around the neck region, the one which is the most outer one is called as investing layer of deep cervical fascia. So let us write down the name. The very first, which is totally outside the neck, is called as the investing layer of deep cervical fascia. Now, what about the other two? There will be two more, and here we will find that towards the posterior side we have the vertebra, basically the cervical vertebra. Let us say this is the cervical vertebra. Around the cervical vertebra will have one fascia, but this fascia, as it is also in front of the vertebra, we call it as prevertebral fascia. Though it is not only in front of the vertebra, it is going around the vertebra. The muscles which are related with the vertebra, the vertebral muscles, it will be surrounding them. So in the diagram you can understand better. We are calling it as the prevertebral layer of deep cervical fascia, since it is in front of vertebra. As you can see, this is the fascia, but not only it is in front of the vertebra. As I'm telling, this fascia is not only in front of the vertebra, so that you can call it as prevertebral layer of deep cervical fascia. It is also around the vertebra, covering some of the muscles which are related to the vertebra. Then we have a third one, and we are calling it as the pretracheal layer of deep cervical fascia. And as we talk about this layer, again the name is suggesting it will be in front of the trachea. In fact, not only trachea but also the esophagus. There are two tubes basically. There is a gut tube, in front of that is the respiratory tube. In the gut tube we'll have the pharynx, and in relation with the respiratory tube we'll have the larynx. So pharynx, larynx together, but if you continue down, the pharynx will become esophagus and the larynx will become trachea. So the two tubes, as we are talking about, we can draw them here. One of them is the gut tube, and from the gut tube embryologically we'll have the respiratory tube developing, and in the respiratory tube we'll have the trachea. In front of that trachea we are having this fascia, and that is why we are calling it as pretracheal fascia. So as it is in front of the trachea, we are calling it as pretracheal fascia, but it is not only in front of the trachea, it is going around the two tubes like this, and we have to be aware about it. So there are three things now we are supposed to talk about. Plus we understand there is a carotid sheath in the neck region around the carotid arteries. And this carotid sheath will not only have the carotid arteries, it will also include the internal jugular vein and the vagus nerve. This carotid sheath is getting contribution from all the three layers. As you can see here, there is going to be one carotid sheath on either side, and this carotid sheath is being contributed by all the three fascia. May it be the investing layer of fascia, as you can see, or may it be the prevertebral layer, and also getting its contribution from pretracheal fascia. So how this carotid sheath, one on the right side, one on the left side, is going to be contributed by the three layers of deep cervical fascia, that also we have to discuss about. Now, in this diagram, we are looking from the front view, and we are talking about deep cervical fascia, the three layers of deep cervical fascia. The one which is the outermost circular fashion all around the neck, we have mentioned it is called as the investing layer of deep cervical fascia, number one. Then we were telling there is one fascia which is in front of the vertebra and also around the vertebra, covering some muscles along with the vertebra, and we were calling it as prevertebral layer of fascia. So this is number two. Then we were telling there is a fascia which is in front of trachea, but not only in front of trachea, it is around the trachea, even around the gut tube. So around the respiratory tube, gut tube, in a circular fashion again. These are three circles basically, the outer circle, and there are two inner circle. one circle which is around the vertebral level and one which is in front, but in front of trachea and around the trachea, around the pharynx. This is number 3 and we are calling it as pretracheal fascia. It might confuse you that is it only in front of trachea? No, it is in front of trachea and also around the trachea. We will keep discussing the details, but now let us first start with the very outermost, which is the investing layer of deep cervical fascia. The color code, you can see this blue color is the investing fascia. And then if you remember, we have been talking about this muscle which is called as the sternocleidomastoid and forming the boundary for the posterior triangle. In the posterior triangle, we also include the clavicle, and then posteriorly we have this trapezius. So this is the trapezius muscle. We understand that when we are focusing upon the posterior triangle, it will be having 3 sides because it's a triangle. It will be the middle 1/3 of clavicle, posteriorly the trapezius, anteriorly the sternomastoid, and they are being surrounded by this fascia, which is investing layer of deep cervical fascia. Now what happens is, you have to understand, first of all, it is the outermost circle, and number 2, as it will come here, it will split and enclose the sternomastoid, and then it will go and split and close the trapezius also. Let us show that in here. This is the investing layer of deep cervical fascia. It will split and enclose the sternocleidomastoid, and then it will go split and close the trapezius as well. So in the process, when this investing layer of deep cervical fascia covering the neck in a circular fashion, splitting and enclosing sternomastoid and then splitting and closing trapezius, it is going to become the roof of posterior triangle. So here, this area, when you look at the posterior triangle, it is covered by a fascia, that is the investing fascia forming the roof of posterior triangle. If you strip this fascia, then only you will see the muscles which are there at the floor of posterior triangle. If you remember, muscles like scalenus medius, scalenus posterior, levator scapulae, all those muscles can be seen only if you remove the investing layer of deep cervical fascia from the roof of posterior triangle. And then only you will see those muscles, they were covered by another fascia, that was the prevertebral layer of cervical fascia, which can be seen now on the other side. So let us look at the number 2, that is the prevertebral layer of cervical fascia. Here once again you have to mark out the trapezius. This is the trapezius muscle, and if you're talking about the sternocleidomastoid, it has been cut here to expose the deeper structures, but here part of the sternocleidomastoid is evident and partly it is evident there. We wanted to see the structures deeper to that, for example the carotid sheath, that is why the sternomastoid has been cut. Plus, as you see, the blue color fascia, that is the investing layer of deep cervical fascia, has been removed so that you can look at the floor of the posterior triangle. This green color is the floor of posterior triangle covered by this green fascia, that is prevertebral fascia. And let us shade that now in yellow color. So this yellow colored fascia you cannot see. This prevertebral layer of fascia you cannot see until you have removed the superficial one, the investing layer of deep cervical fascia. Once you remove it from the roof of posterior triangle, then you can see the structures which are at the floor of posterior triangle, and at the floor of posterior triangle you are having prevertebral fascia covering the muscles like you will have the scalenus medius, scalenus posterior, levator scapulae muscles, all at the floor of the posterior triangle, bounded by the 2 muscles, the trapezius posterior, sternomastoid anterior, and middle 1/3 of clavicle is at the base. Now that was about the prevertebral fascia. Let us focus upon the 3rd layer, which is pretracheal fascia. As you can see, this is the trachea, and in front of trachea, this yellow-orange color fascia is the pretracheal fascia, the number 3. Now, this fascia is not only in front of trachea, but it is like a circular fashion around the respiratory tube and also gut tube. Plus, now it is having further subdivisions. Actually, pretracheal fascia will have one muscular layer, and it will be covering the strap muscles which are in the anterior neck. So in the anterior neck, you have some strap muscles. Even as you see, this is the omohyoid muscle, and covering the omohyoid muscle is the muscular layer of pretracheal fascia. Then it will have a visceral layer of pretracheal fascia. It will cover the viscera like the trachea and the esophagus, the larynx and the pharynx. So my point is, pretracheal fascia itself is having certain subdivisions, like it has a muscular component to cover the muscles, and it has a visceral component to cover the viscera. The muscles could be the strap muscles or even the muscles like the omohyoid muscle. As you see, this color is covering all the muscles here. The sternohyoid, for example, the omohyoid is the other example. So covering the muscle, the strap muscles or the omohyoid muscle, plus this pretracheal fascia, as the name is suggesting, will have a visceral layer also. And when it comes to the visceral layer, it might be the trachea itself, the respiratory tube, or the esophagus, the gut tube. So pretracheal fascia, again having some subdivisions. It will be found in front of the trachea and also around the gut tube. As we continue further, it is to be understood the three fascia, that is investing fascia and the prevertebral fascia plus the pretracheal fascia, they all will be contributing to carotid sheath. This is the carotid sheath. And as you can see inside the carotid sheath, we are having the carotid artery, which can be the common carotid artery continuing as the internal carotid artery and followed by the internal jugular vein, which is on the lateral side. And between the two, behind the two, will be the vagus nerve. So these are the contents of the carotid sheath, and this carotid sheath on both sides will be contributed by the three fascia. As you can see here, in front of the trachea, this color, it was the pretracheal fascia, and it will be contributing to the carotid sheath here. So contribution by the first layer, that is investing layer of the cervical fascia, forming the carotid sheath. Number two, as you can see, this is the prevertebral fascia, which was posteriorly present, and even prevertebral fascia, as you trace it upward, will be contributing to the carotid sheath from posterior aspect. So from posterior aspect, you have prevertebral fascia. From anterior aspect, you are having the pretracheal fascia. Then the one which have been removed from here, as you see, it will be evident here. The third one, investing layer of deep cervical fascia. Until otherwise you remove the investing layer of deep cervical fascia, you cannot see the deeper structure. Like you can see, the carotid artery is inside the carotid sheath. So little bit of carotid sheath can be seen, and that was being contributed by the outermost layer, that is investing layer of deep cervical fascia. So carotid sheath is having contribution from all the three layers of deep cervical fascia. Here we are looking at a patient in supine posture. The head is towards us, the feet are away from us, and we are taking transverse section at the level of neck region. So this will be anterior, this is posterior. Posteriorly you will have the vertebra and respiratory tube, gut tube in particular arrangement. Now as we know, deep to the skin there will be superficial fascia. We are not focusing upon that. We are focusing upon still deeper, that is the deep layer of cervical fascia in the neck region, and this transverse section has been taken there. So outside will be skin, superficial fascia, but here we are talking about the deep layers of cervical fascia, three of them, which further keep subdividing themselves, and they are arranged in a circular fashion. There is one outer circle and then there are two inner circles. So let us look at the very first one, which was outermost, that is the investing layer of deep cervical fascia. Starting from the anterior, you can trace the fascia, and as we have mentioned, it will be splitting and enclosing some muscles, like that could be the sternocleidomastoid or the muscle like the trapezius muscle, and as we trace it further, it will go around the neck region. So going posteriorly, and again as you trace it back on the right side, here again it is splitting and closing muscles, may be the trapezius and the sternomastoid, and you can join it on the other side. So this was the outermost. Number one, the investing layer of deep cervical fascia. And then let us look at number two, that is prevertebral layer of deep cervical fascia. Again, it is in a circular fashion and it is shown here. The number two, prevertebral layer of deep cervical fascia. The name is such because it is in front of the vertebra. You can see this is the body of the cervical vertebra, and this is the vertebral canal, in which you can also see the spinal cord. So in front of the vertebra, this is the prevertebral layer of deep cervical fascia, and it is not only in front of vertebra, but as you can see, it is going around the vertebra, covering the paravertebral muscles. As you see, these are the paravertebral muscles surrounded by the prevertebral layer of deep cervical fascia, number two. Then we have number three, that is the pretracheal fascia, which itself keep dividing into various components. If it is around the viscera, you say visceral layer of pretracheal fascia. If it is around the muscles like the strap muscles, muscular layer of pretracheal fascia. So two of them are shown here now, and this is the third one, the the pretracheal layer of deep cervical fascia. The visceral portion is shown here and the muscular portion is shown there. Let us first focus upon the visceral portion. The viscera, as we can see, will be the respiratory tube on the anterior side and the gut tube on the posterior side. Say for example, anteriorly you can have the larynx becoming trachea inferiorly, and posteriorly it is the pharynx becoming esophagus inferiorly. So larynx becomes trachea and pharynx become esophagus. These two tubes, the visceral tubes, they are covered by the visceral layer of pretracheal fascia. And this fascia is not only in front of the trachea, but it is around the trachea, actually around the pharynx. In fact, it is around the respiratory tube and the gut tube. So we are calling it as pretracheal visceral portion, deep cervical layer of fascia. And since it is visceral portion, it will enclose even the viscera like the thyroid gland. One lobe here, isthmus on the anterior side, the other lobe of thyroid gland here. We understand the thyroid gland is present in front of the trachea and will be enclosed by the pretracheal layer of the deep cervical fascia, the visceral portion. So here, the pretracheal visceral portion covering the viscera like thyroid in front of the trachea, and this is the fascia we are talking about. And then pretracheal fascia has one more component. You can say this is 3A and this is 3B. The pretracheal fascia, the muscular layer, which you can see is splitting and enclosing the anterior neck muscles. And these anterior neck muscles could be the strap muscles like sternohyoid or the other muscle we have talked about, the omohyoid. So sternohyoid and omohyoid will be covered by the muscular layer of pretracheal fascia. Then we were telling these three layers. Number one, it is the investing layer of deep cervical fascia. Number two, it is the prevertebral layer of deep cervical fascia. Number three, it is the pretracheal layer of deep cervical fascia. All will contribute to the carotid sheath. This is the carotid sheath on the right side because you're looking from superior view. This is right-sided and then left-sided carotid sheath. And this carotid sheath, inside that is carotid artery. More medial is the carotid artery. If you go lateral, then it will be the vein, internal jugular vein. So the vein is lateral internal jugular vein, and between the two, behind the two, is the vagus nerve. This is the vagus nerve. So these structures are enclosed by the carotid sheath, and this carotid sheath has contribution from all the three layers of the deep cervical fascia. As you can see from the anterior, it is contributed by pretracheal layer of deep cervical fascia, and from the lateral, it is contributed by the investing layer of deep cervical fascia, and from the posterior, it is contributed by the prevertebral layer of deep cervical fascia. So this is the posterior contribution to carotid sheath, that is the medial contribution to carotid sheath, and that is the lateral contribution to carotid sheath. Laterally investing fascia, medially the pretracheal fascia, posteriorly the prevertebral fascia. And now we are supposed to deal with one of the MCQ which has been asked on the layers of deep cervical fascia. But before that, let us put some information in this diagram. If you remember, this carotid sheath in the anterior wall is embedded the ansa cervicalis coming from cervical root values. So embedded on the anterior wall of the carotid sheath is ansa cervicalis, and this ansa cervicalis is supposed to supply some muscles which were being covered by this pretracheal layer of the deep cervical fascia. If you remember, we have talked about two muscles like sternohyoid, omohyoid. So this sternohyoid and omohyoid muscle, both attaching to hyoid bone, covered by the muscular portion of pretracheal fascia, will be supplied by ansa cervicalis. So this ansa cervicalis is supplying the muscles, omohyoid and sternohyoid, the strap muscles. This is one information we require here. Plus this deep cervical fascia, the pretracheal layer, gets modified to form a ligament of Berry, and that ligament of Berry is going to attach the thyroid gland. We were telling this is one lobe of the thyroid gland, then there is one isthmus in the middle, the other lobe of thyroid gland. The thyroid gland is getting attached to the larynx, basically the cricoid cartilage of the larynx, with the help of a Berry ligament. So Berry ligament is attachment of the thyroid gland to the larynx, the cricoid cartilage part of the larynx. And the importance of that is when we are swallowing, the larynx moves up and down, and with the moving larynx up and down, even the thyroid gland is moving up and down, because thyroid gland is fixed to the larynx, the cricoid cartilage. By a modification of of this deep cervical fascia, that is the pretracheal fascia, the ligament of Berry. And with this information, you add one more detail here. You see, this pretracheal layer we have mentioned is having some divisions. 3A, the visceral portion, 3B, the muscular portion, and 3C. On the posterior aspect, this pretracheal fascia gets modified, and this modified portion of pretracheal fascia, which is now behind the pharynx or behind the esophagus, that means behind the gut tube. So behind the gut tube, may it be the pharynx or the esophagus, the pretracheal fascia is getting modified to be called as buccopharyngeal fascia. So here now I am putting 3C, that is the pretracheal layer of deep cervical fascia getting modified as buccopharyngeal fascia. So what exactly is buccopharyngeal fascia? Bucco, pharynx, as the name is telling, gut tube. It is behind the gut tube modification of the pretracheal layer of deep cervical fascia, which is now having 3 layers. The 3A, visceral portion, 3B, the muscular portion, and 3C, the buccopharyngeal fascia. Behind that, you will have a space. That means behind the pharynx, you will have a space, and that space, which you will find here behind the pharynx, will be called as retropharyngeal space. So basically, retropharyngeal space, the anterior boundary, is formed by buccopharyngeal fascia. Behind the pharynx, you have retropharyngeal space, and this space is bounded anteriorly by a modification of pretracheal fascia, which is called as buccopharyngeal fascia. Now, behind the pharynx, you have retropharyngeal space. In front of the vertebra, you have prevertebral space. And between the two, that is prevertebral space posteriorly, retropharyngeal space anteriorly, between the two, you will have another space, which is called danger space. So we'll be talking about the spaces in more detail, but for an orientation in this particular diagram, let me zoom this diagram now. Just to give you an idea what I'm talking about the 3 spaces. If it is behind the pharynx, you will say retropharyngeal space. If it is in front of the vertebra, you will say prevertebral space. And between the two, you will have a danger space. But more details are coming up. Let us first deal with the MCQ, which we have got here. So this is the question we are talking about. It is asking us about the cervical fascia, and the choice of exception means the wrong statement. We have just seen that there is a ligament of Berry which is fixing the thyroid gland to the cricoid cartilage, that is basically larynx, and that is why as the larynx is moving up and down while we swallow, the larynx is moving up and down. Along with the larynx moves even the thyroid gland, because thyroid gland is attached to larynx, specifically to the cricoid cartilage with the help of ligament of Berry. And this ligament of Berry is a modification of the deep cervical layer of fascia, the pretracheal layer, and it is a modification. We'll see that in our diagram as well, but this is a correct statement. No problem here. Then what about choice number B? As we read choice number B, prevertebral fascia is forming the... No, it is not forming the roof. If you remember, the roof is formed by the investing layer of deep cervical fascia. In fact, the prevertebral fascia was at the floor of the posterior triangle, covering some muscles like we have discussed, the scalenus medius, scalenus posterior, levator scapulae. These muscles are at the floor of the posterior triangle covered by the fascia. On the floor of posterior triangle, that is prevertebral fascia. You cannot see that fascia until you have removed the fascia which is at the roof, investing layer of deep cervical fascia. So the outermost is investing layer of deep cervical fascia, which was splitting and enclosing muscles like sternomastoid, forming the roof of posterior triangle, split and close the trapezius. So at the roof, we have investing layer of deep cervical fascia. You remove it, then you can see the floor covered by prevertebral layer of deep cervical fascia. That is why choice number B is a wrong statement, and that becomes the answer of exception about the cervical fascia. And we already have discussed ansa cervicalis is definitely embedded in the anterior wall of the carotid sheath, and there it was supplying some of the muscles like we have discussed: sternohyoid muscle, omohyoid muscle. These muscles themselves covered by the muscular layer of pretracheal deep cervical fascia. So no problem with choice number C, even no problem with choice number D, because this carotid sheath is not only contributed by pretracheal layer, the pre-vertebral layer, but also investing layer of deep cervical fascia, the 3 layers of deep cervical fascia. If you talk about the investing layer, it will be contributing laterally to the carotid sheath. If you're talking about the pretracheal layer of deep cervical fascia, it was contributing from the medial side. And if you're talking about pre-vertebral layer of deep cervical fascia, it was contributing from the posterior side. So carotid sheath has contribution from 3 layers of deep cervical fascia, no problem here. The only wrong statement here is choice number B, and that remains the answer of exception. And we can see a diagram also to confirm about the ligament of Berry. As you can see, talking about the ligament of Berry, we are looking from the front view. This is the larynx having thyroid cartilage, the cricoid cartilage. This is the cricoid cartilage of larynx. Below that is the trachea. Thyroid gland is basically on the tracheal rings. When it comes to the isthmus, we have pulled the thyroid gland to one side, as will be evident here. So this is the cricoid cartilage we are talking about, a component of the larynx, that is thyroid cartilage. Below that is the trachea. And this is the Berry ligament. So the Berry ligament is basically connecting the cricoid cartilage with the thyroid. The thyroid gland is being pulled to one side here, and there is importance of this ligament of Berry. While you are trying to remove the thyroid, that is thyroidectomy, you have to take care of this nerve, the recurrent laryngeal nerve. The recurrent laryngeal nerve, which is supplying almost all the muscles of the larynx, is having a landmark related with the ligament of Berry, which is connecting the thyroid gland posteriorly to the cricoid cartilage. And that is the reason when we are swallowing and the larynx is moving up and down, even the thyroid gland is moving up and down because of this modification of the deep cervical fascia, the pretracheal layer of deep cervical fascia. We have got one more diagram to discuss details of the pretracheal layer of deep cervical fascia and ligament of Berry. It keeps coming in the MCQs. This diagram is looking from the lateral view, the thyroid gland, the component of the larynx, and the pretracheal layer of deep cervical fascia getting modified as the ligament of Berry. So this is the ligament of Berry, which is a modification of the fascia visceral layer of the pretracheal deep cervical fascia, which is also making a false capsule around the thyroid gland. And this fascia does not allow the thyroid gland to extend further upwards. This comes as a question, why the thyroid gland enlargements are not going superiorly? Who is preventing that? That is because of this pretracheal layer of deep cervical fascia. It doesn't allow the thyroid enlargements to go superiorly. In fact, thyroid glands goes inferiorly towards the thorax, retrosternal. So this fascia, which is making a false capsule around the thyroid gland, is also extended inferiorly towards the thorax region, connected to the fibrous pericardium around the heart, and it extends superiorly towards the hyoid bone as well, attaching to hyoid bone. But the point is, because of the pretracheal layer of deep cervical fascia, the gland cannot extend superiorly if it is enlarged. It extends inferiorly. Plus the modification, ligament of Berry, it was attaching it to the cricoid cartilage anteriorly. This again is another MCQ. Now we want to talk about some spaces in the neck region related with these fascia, and we are continuing with the details which we already know and put some added information. Looking at this diagram, you can understand around the neck region we have a deep cervical fascia arranged in a circular fashion, and it is the outermost, and we are calling it as the investing layer of deep cervical fascia. So this is the investing layer of deep cervical fascia. Deep to that we have 2 more circularly arranged layers of deep cervical fascia, like one which is in a circular fashion and in front of the vertebra. This is number 2. We are calling it as pre-vertebral layer of deep cervical fascia. So it is not only in front of the vertebra but also around the vertebra, covering the paravertebral muscles, and it will be moving along with the vertebra. So this is the second fascia arranged in a circular fashion. Then we can talk about the third layer, and that is around the respiratory tube and the gut tube. We are calling it as pretracheal fascia because it is in front of the trachea. But this layer number 3, the pretracheal fascia, is not only in front of the trachea, it is around the trachea. In fact, it is around the respiratory tube itself. So we can show the tubes. Say this is the respiratory tube coming down, which will be larynx initially and then continuing as the trachea. Behind that is the gut tube, which will be initially the pharynx, and the pharynx will then continue downward as the esophagus. And covering these tubes is the pretracheal fascia. Then if you remember, this pretracheal fascia is modified posteriorly to form the buccopharyngeal fascia. So if we are looking at a modification of the pretracheal fascia posteriorly, we are calling it as the buccopharyngeal fascia. You can actually name this fascia here. This is the buccopharyngeal fascia, which itself is a modification of the pretracheal fascia. And now we have to talk about one modification of the prevertebral layer of deep cervical fascia as well. This prevertebral fascia is going to split and giving one anterior layer, and that anterior layer of the prevertebral fascia is called as the alar fascia. You can remember A for A. Anterior splitting is the alar fascia. Now, once we have mentioned about the alar fascia as well, we can name the prevertebral fascia also as the prevertebral fascia, the proper. So it was the prevertebral fascia which is in front of the vertebra, which continues itself as the proper prevertebral fascia, but then it has given one anterior splitting, A for A. That anterior splitting is called as alar fascia. This time you have three fascias, and then there are three spaces which are related to these fascia. So what are the three fascia anterior to posterior? Anteriorly we have buccopharyngeal fascia, which is the posterior modification of the pretracheal fascia, and number two, alar fascia, which is a modification or anterior splitting of the prevertebral fascia, and number three, it is the prevertebral fascia proper. And what are the three spaces then? Talking about the spaces, you will find this is the pharynx becoming esophagus, and behind that there is a space, and that space you can put it as number 1 is called as retropharyngeal space. So space number 1 is retropharyngeal space. And where is this retropharyngeal space? Behind the pharynx, behind the esophagus. Then you can talk about space number 2. Space number 2 is here. It is danger space. So space number 2, which is danger space, where exactly it is lying? The danger space is lying between the two fascia. One of that is the alar fascia anterior and the prevertebral fascia proper posterior. A for A, P for P. Anterior is alar fascia, posterior is prevertebral fascia proper. And what was the retropharyngeal space bounded by? Retropharyngeal space is bounded by anteriorly the buccopharyngeal fascia, which is a modification of pretracheal fascia, and posteriorly it was alar fascia. So this is space number 1, the retropharyngeal space. Then you have space number 2, the danger space, and then space number 3. This space number 3 is the prevertebral space, and as the name is suggesting, it will be in front of the vertebra, hence the name prevertebral space. So as you can understand, this is the neck region. In the neck region you will have the cervical vertebra, say this is the cervical vertebra region, and in front of these cervical vertebra we are having the space. That space is called as space number 3 or prevertebral space. So 3 fascia and the 3 spaces. Let me zoom this area a little bit now so that you can have a closer look. So what are the 3 fascias? Fascia number 1 is the buccopharyngeal fascia modification of pretracheal fascia. And what is fascia number 2? It is alar fascia, the anterior modification of prevertebral fascia. And what is fascia number 3? It is the prevertebral fascia proper. And what are the 3 spaces? The 3 spaces are space number 1, which is retropharyngeal space. Retro means behind, so behind the pharynx. And this retropharyngeal space, if it is behind the pharynx, you will say retropharyngeal, but then it will continue down as retroesophageal space. Proximally it is pharynx, distally it is the esophagus. So this space number 1, if you look at it here, retropharyngeal space, if you continue down, it will become retroesophageal space. So space number 1, retropharyngeal space, is bounded by which fascia? It is bounded by the buccopharyngeal fascia anterior, alar fascia posterior. And what about space number 2? Space number 2 is the danger space. And danger space is bounded by the 2 fascia. Anteriorly, it is the alar fascia, A for A, and posteriorly, P for P, the prevertebral fascia proper. And what about space number 3? Prevertebral space. Space number 3, the prevertebral space, is called so because it is in front of the vertebra, in front of the cervical vertebra, and bounded by the cervical vertebra posteriorly and prevertebral fascia anteriorly. Now, if there is some pathology of the vertebra, say tuberculous vertebra, pus formation. That pus can track into prevertebral space and also into danger space. And using these spaces, it can actually track from the neck region towards the thorax region because there is a continuity. So pus in the neck can track down to the thorax, the pus itself coming from the tuberculous vertebra, and that is why these spaces are important, especially when we talk about the danger space. And as you can see, danger space is sandwiched between retropharyngeal space anteriorly and prevertebral space posteriorly. And once we have talked about these three fascia and the three spaces, let us take one transverse section also in the same region to talk about the three spaces and the three fascia. And that will be the next diagram, a transverse section at this level. And as you can make out, this is a transverse section. The person is lying supine. The head is towards yourself. The feet are away. And in the neck region, we have taken a transverse section to talk about the three fascia and the three spaces. The three fascia we were talking about, posterior to anterior, you can say here, will be number 1, prevertebral fascia, and splitting anteriorly, A for A, the LR fascia. And then we have the number 3, buccopharyngeal fascia. Let us locate them in the diagram then. As you can see, this is the spinal cord in the vertebral canal. This is the body of the vertebra. In front of the vertebra, we are having this fascia, and as you trace this fascia, we already have named it as the prevertebral fascia. It was this prevertebral fascia which was splitting to give anteriorly LR fascia. So let us look at the number 2 LR fascia as well, which can be seen here. Prevertebral fascia splitting and giving one anterior layer. This anterior layer here is the LR fascia. So this is the marking for the LR fascia. And if you go still anterior, it is the buccopharyngeal fascia, fascia number 3. So as we understand, there is respiratory tube, behind that is gut tube. We'll have the larynx, behind that pharynx, or maybe the trachea, behind that esophagus. And they were surrounded by what is called as the pretracheal fascia. That pretracheal fascia posteriorly was modified. So this is the modification of the pretracheal fascia, and we were calling it as the buccopharyngeal fascia. So this is the buccopharyngeal fascia. Let me zoom this area now so that you can have a better orientation. And as we are doing so, we can talk about the spaces as well. So what is this fascia which is in front of the vertebra? In front of the vertebra, this is what we are calling as the prevertebral fascia, which was splitting then to give an anterior layer, the LR fascia. This is the LR fascia. And if we are looking behind the pharynx or even the esophagus, the fascia which was modified here, modification of pretracheal fascia called as buccopharyngeal fascia. Now, what is this space behind the pharynx? That is going to be the retropharyngeal space on the right side and on the left side. So if we say this is the trachea, this is pharynx, behind the pharynx is the retropharyngeal space. And what is this space which is bounded between the two layers of prevertebral fascia? That is the danger space. And what is the space which is in front of the vertebra? That is prevertebral space. So prevertebral space is bounded by what all structures? The prevertebral space which is in front of the vertebra is bounded by the vertebral bodies posteriorly and the prevertebral fascia proper anteriorly. Then what about the danger space? The danger space is bounded by prevertebral fascia posteriorly and LR fascia anteriorly. A is A, LR is anterior, and P is P, prevertebral fascia is posterior. This is about the danger space. Then what about the retropharyngeal space which is behind the pharynx? It is bounded by the buccopharyngeal fascia anteriorly and LR fascia posteriorly. And as we zoom out, you can look at the naming of the spaces as well. The three spaces, as you see, are being mentioned here. If it is a space which is in front of the vertebra, we are calling it as the prevertebral space. This is going to lie between the vertebral bodies posteriorly, and anteriorly it will be prevertebral fascia. Then if we are talking about the next space, which is the danger space, this danger space is now lying between two layers, A for A and P for P. Anteriorly the LR fascia, posteriorly the prevertebral fascia. And we are calling it as danger space because normally it is a potential space, but it can be filled with some pathological collection like the pus coming from tuberculous vertebra, and it can track down from the neck towards the mediastinum, towards the thorax region. Hence, it is called danger space. And in front of that, behind the pharynx or behind the esophagus, you can call it as retropharyngeal space or retroesophageal space. And this space is then bounded by two fascia. The fascia which is lying on the front is the buccopharyngeal fascia, modification of the pretracheal layer behind the pharynx or esophagus. And if you are talking about the fascia which is behind that will be the alar fascia. So three spaces and the three fascia. If you say posterior to anterior, the posterior most is the prevertebral layer, then anterior to that is the alar fascia, still anterior is the buccopharyngeal fascia. If you talk about the spaces, first is the prevertebral space, then is the danger space, and then we have the retropharyngeal space. Now we get one MCQ on the same topic. A question asking about the danger space. And as we remember, A for A, P for P. Anterior was the alar fascia and posterior was the prevertebral fascia proper. In fact, we have mentioned this prevertebral fascia itself is splitting anteriorly to give alar fascia, and between the two we have the danger space. So obviously in this question, if we talk about the danger space, it is situated between the choice number C is your answer. Prevertebral fascia, which is posterior, and alar fascia, which is anterior. Choice number C should be our answer here.